We cannot start with the existing things and say that this is the best suited. And we will have to see what is happening every 24 hours. Now, my office with 5,000 people are working on an 8x3 shift basis. We have to see what is happening and then, rework our, technology or, add on to our features so that we give them the maximum satisfaction. So other things will, come in automatically. And I would say that what we started with 66 crore project, pilot project, is now running at 1200 crore project. And today we have realized that with the same cost, we can cover more and more diseases. Initially we too thought that the cost will escalate. No, it's not so. And 3.5 years, we are finding that the cost is stabilizing. Yeah, that's all I would like to tell as my keynote address. Before I complete, I'll try to show you what exactly is. Let me see. No, sir. Actually, what we are focusing is through the health camps. We are actually giving, medicines and other things for common diseases. Immunization as of now is not covered. But it has got a future in the sense that, with the present systems, we can go in for universalization of health coverage, in which, immunization can also be part of it. As of now, we are dealing with, the common diseases, etc., which is existing in the villages through our system. Yeah.
I just wanted to congratulate you on a fantastic bit of work.
Thank you.
This is a very valuable resource material.
Yeah.
Do you have plans of using this for medical education and paramedical education, continuing education?
Absolutely. In fact, absolutely. In fact, a committee has been formed into it. Actually in the last 3.5 years, we didn't have much time. We were just doing the project. But now we have realized that we have got records of around 43 lakh patients in our system, with their background, with their data, medical records, etc. So now we have made a committee, and this committee is looking at how to use this data for better purpose. In fact, now we are going to integrate a business BI tool in order to bring out, exact, causes of this, and then take out policy decisions. Yeah, that's happening. Thank you. Yeah. Exactly.
All other states must look into this very seriously.
Yeah.
Currently, from the country, we are, I think, projecting just 500,000 cancer cases.
Absolutely.
But I was wondering, you are doing just a detection part, or
treatment?
There is some intervention?
No, there is an intervention. See, we are planning it. We are doing at 2 levels. One level is the awareness part of it. Through these health camps, which are around 750 health camps in a month in this state, we are making our service providers to pass on the messages of, why this is happening. How can this be detected early? Early detection is the crux in Arogyasri, in cancer. So we are giving them suggestions of how to do it. And when we are identifying, we are giving the treatment, we are giving treatment also. Now what we are finding is, out of this 120,000, 70,000 are curable cancers. Around 50,000, are palliative, require palliative approach. Now these 70,000 can be treated provided they are identified at the proper time. But with the current existing infrastructure in the state, out of the 70,000, we are able to treat only 35 to 40,000, leaving a gap of another 30,000. Now, what we have seen in the last 3.5 years, around 17 new machines came into the state. Machines mean the LINAC and HDRs and other things. And before this scheme, we had only, around 12 machines. And today, the state has got 29 machines. which is the highest in the country. And this realization came because of this, identification of these cases. Yeah. So it has got a potential. Yeah. Yeah. So now what we are planning is to come out with a, cancer, not only cancer, even trauma. In these two sectors, we are trying to come out with, a new model of, on a PPP model, how to improve, how to, ensure access for healthcare in these two aspects. Already we did it in hemodialysis to some extent. That is a very successful venture, which, before these centers were put in, only 1,200 people were getting treatment for hemodialysis in this state. After this model, now in a month, 1,200 patients. After this model, we are treating around 3,500 patients. And still there is, many people who are suffering from kidney problems. Yeah.
Sir, actually, these equipments and the facilities are coming in urban area, not in the rural area.
I don't agree to that. Because when we started, we had only 36 hospitals in 4 locations. Hyderabad, Vijayawada, Vizag, and one more center, Rajamundi something. Now we have got 350 hospitals in 73 locations of the state. 73 locations. All the major groups are now going into districts. You will be seeing, I need not name them. It is already happening. And we have got major groups from outside state coming into the state. These major groups from outside state initially approached our CM and government that we will take patients to, our outside the state and treat. But we told no. If you want to treat, come to our state and put in. That is actually creating wonders. What we have seen in last 3.5 years, 6,000 new beds have been added in this state. 6,000 new beds. I got the data of that. And as on any date, around 15,000 patients are on bed under Arogyasri. So 6,000 new beds have been added. And it has come to a level where some of the big players are even announcing the Arogyasri packages for non-Arogyasri patients too. So it is actually, bringing down or leveling the cost also to some extent.
There were some recent reports
Yeah.
stating that the NRHM funds which are financing the scheme.
NRHM is not, we are not taking one pie from NRHM for the scheme. That's absolutely baseless. We are not even taking 1 rupee from NRHM for the scheme. It's a totally state government budgeted scheme. Absolutely, that is what I was trying to show, but I have got a connectivity problem here. Otherwise, I would have shown you, the current status, what is happening in terms of the patients, etc. We can see presently how many patients are just got into the hospital. Their complete data in terms of, their indications come to us. It is being verified by two other doctors before the treatment takes place with definite time frames, and they establish the indications and then do the procedure. And after the procedure is done, outcomes are defined. And outcomes, what should be the evidence for outcomes, that are also defined. And then we also get the feedback from the patient. A common feedback, whether you are happy or not. Let me tell you, I mean very, in fact, I myself was surprised. With these kind of systems put in, we have only less than 1% negative feedback which was coming in. And that too were addressed through our field team. Then a definite policy on empanelment of hospitals. Today you see with this scheme, it has been told to me by friends from hospital industry themselves. With this scheme, the way in which case sheets were maintained in Andhra has improved tremendously. The way in which, indications were established has improved tremendously. And there has been a control on over-diagnostics too. Because the scheme doesn't pay for any kind of diagnostics because of its package limitations. So whatever you diagnose, this is what you are going to be given. So there is a controlled way of doing the things. In fact, it's a win-win situation for all. It is not that anybody is failing in this scheme. It's a win-win situation because 85% are getting access to healthcare all of a sudden. Earlier we had vacancies in many of these hospitals. Today they are adding on beds. That's the thing. Everything is electronic. Everything. In fact, I'm not able to show. If you give me a connectivity properly, I'll be able to show. Yeah, prescriptions are also, and we are given bringing out even the outpatient prescriptions are electronic. Yeah, it is available. I mean, what the doctors put in is in English. I'm very sorry to say that. But the titles, etc. are there in Telugu. Yeah.
Hello.
2 lakh thousand. 2 lakh rupees.
Earlier it was 30.
No. In the other schemes, it is 30,000, I told. You take Rashtriya Swasthya Bima Yojana of Government of India. The average premium is around 500 to 700 rupees. And the coverage is only 30,000 for a family. But here our average premium is 350 rupees. We are giving a coverage of 2 lakh rupees.
Fine. Okay, thank you.
It's 2 lakh rupees. And what we have found is with 2 lakhs, other than, heart transplantation or liver transplantation, or a, gamma knife, or, bone marrow, most of the, problems can be covered. Yeah. That's it.